thousand people have passed and done it.
Yes,
So I have a
yes,
way of doing things. May not be the
yes,
most streamlined way, but there is a
yes,
purpose why we do things the way we do it.
yes,
So tell me,
yes.
how's your experience? Like, you went
Uh,
to the board and then you're feeling anxious, or you were kind of like, okay, I got this. And how was
so
it for you?
I was kind of anxious because I was like, wow, this is a lot. I told you I was having issue with the neurotransmitters and the therapies, and I did what you asked me to do. So even
Yeah,
when I was driving there, I was kind of like looking at my notes that I did and everything. So I got there, I was very anxious, and I didn't. But when I started the exam, I was like, wow, Dr. Lopez said this. I had questions about the dopamine pathway. What if somebody is having symptoms of EPS? Which of the pathways? And I have questions about Accutane for depression. In trifling with a dog in a sexual manner, you report to CPS. And also, if somebody is taking doxycycline and they are taking Tegretol, what will happen? Then also a child came in, they are recent with a
can you,
recent acute fatigue and weight
man?
gain.
Can you come a
Uh-huh.
little closer to your mic because I really want to hear you? It's kind of breaking
Okay,
down. You're giving a
okay,
lot of good
sorry.
info for the new students. Sorry about that.
Yeah.
Yeah.
So like I said I had a question about like a child playing with a doll in a sexual way. What do you do? I think the answer was report to CPS, and also about the neurotransmitters. Like if somebody has they're having like EPS, which of the neurotransmitters is involved, and also questions about like a lot of cultural questions. I had a
A
lot of
lot of
cultural
cultures
questions.
question. Yes.
Yeah, yeah, like the Latin, I don't know how to pronounce it. The Latin one that starts with the A, A-K-A-N. I had that one. And also, somebody is taking an SNRI effector. What should the provider watch for? And the answer was blood pressure. And also, you have like a homeless patient that is using drugs. What scale would you use to assess them? Which is the SBIRT? A lot of questions like that. And I also had a question about Beck, 1960, 1929. The what also, everything Dr. Lucas was on point. Lewy body dementia, the PICO score, quality study, inducer inhibitors.
Mm.
It was really interesting. I felt like I did it and I was still scared till I found my results.
All right. So how about the diagnostic test? Did you
Oh,
feel
the diagnostic test was very helpful. I saw
very
similar
helpful, right?
questions. Yeah. Yep, I
Very
saw
helpful.
similar questions for the diagnostic test. Because I told you I did it through and I scored 74. I was kind of worried. They told me no, I should be fine. So I
Well,
did it
hold
with
on.
the
What was your score again? I'm sorry if I don't want to.
74%.
Yeah, 74
74%.
was a strong score.
Yeah, yeah,
It,
74. Mm-hmm.
but I always push people to a 80 because I feel that
Yeah,
74 is a good, but
yes,
maybe you're a little anxious, and when we're anxious, so we forget even my own phone number. I couldn't remember my phone number this morning, right?
exactly,
I'm like, what happened?
exactly,
So
exactly.
it doesn't mean that I don't know my phone number. It's just I couldn't remember when I was giving my new number. So
Exactly.
sometimes we get anxious and we forget things that are, like that we know how.
Mm-hmm,
But
mm-hmm.
I'm stoked. I mean, so what's next for you now? Like a new
I,
job or?
yeah, I'm applying for my license, trying to see if I can get a new job. And also, I got a question about Wellbutrin, the sexual side effect. I got to Wellbutrin. I got a question about Lessapro, like patients with cancer. All the things you said in the last minute review, Dr. Lucas, everything. I was like, oh my God, he said this. Oh my God, he said this. I was like, at the
Yeah.
end, I finished in 2 hours, 30 minutes.
Oh man, I know
Yeah.
these results, these excitement, these things. It gets me
Uh,
like, I get still got chills. I mean, these are emotional because I know
uh,
it's the last thing on your next career, right? Um, I mean, it's a lot of things that are in your mind, and everybody's worried. But if you
mhm.
follow the process, I promise you have a 99%
Yes,
chance. Now, it's not
yes,
gonna work for everyone if they just join the course but they don't do the work, right? I mean,
yes,
it's not a magic. I mean, it's hard work and it's a lot of understanding. It's a lot
Yeah,
of
it's a hard work. And even all these meetings that you do, like on weekends, they were very helpful. Like I go back and listen to the meetings. I stop, I take notes, I do everything. It was
yeah.
hard work, but it's worth it. Yeah.
It's worth it, instead of putting you guys through live class, take pictures and see you later.
Exactly.
I really aim to feel that you are supported, that you're getting something out of the course, that
Exactly.
that the results will come. I mean, we can do this. We can just be like, hey, this is a live meeting. I'm going to go as fast as I want to, give you no break, take pictures and see you later.
Exactly.
Sure. I mean,
You're
that doesn't
missing a
work
lot
for
of time.
everybody, right? It will work for some people, but not for everybody. But it really, I ask a lot more of you guys so that we can have a higher passing rate, right? Uh,
Exactly.
it's a
Thank
trade-off.
you
A
so
little bit
much.
more
Thank
hard
you so
work,
much.
but a
Yes.
sure result is coming.
Yes. Thank
You
you
know.
so much. I've requested all my coworkers to you too.
Hey, that's awesome. Good,
Thank
good.
you
I'm
so
so
much.
I'm so happy. I mean, these are the moments that I'm like, yeah. Every time that I feel tired and I get an email saying, "Hey, I passed," I'm like pumped up again.
Yeah,
So thank you
yeah.
for joining today.
And I sent you an email a few minutes ago too.
Oh,
Because I
great.
take a copy of my results and I send it
Thank
to
you.
you. Yeah?
Yes, thank you so much.
Yeah. Yeah,
So,
thank you so much, Dr. Lopez.
yeah,
Enjoy your class today.
yeah. So,
Yeah,
in
thank
the
you.
future, if you feel like you want to up your game a little bit more on the psychopharmacology, I think the
Sure,
next course is at least 3 times as better than this course,
sure. I'll
because
do that.
it's gonna be in detail. You're gonna know things like that. You're like, wow, I never knew about this, and that helps
Sure,
you feel more confident. But we'll talk more
sure.
about that.
Okay,
Okay.
thank you so much, Dr. Lopez. I'll keep in contact.
You have a blessing day.
Yeah, me too. Thank you, sir.
Thank you. Bye bye.
Yeah, bye-bye.
All right. Good. It's always good to hear that people are passing, thriving, doing well, right? So super congratulations to her. Almost just killed the test. So now let's get to this Kahoot. Helen, do you have a question?
Yes, I think I'm in. I just wanted to know. It looks like we have passwords on the screen. At some point, I needed that password to log in the Kahoot.
It should not be. Let me see. I think your name got kicked out. So Kahoot is funny like that. Sometimes it kicks people out. So
Okay.
you may have to log in again. And if they ask you for a PIN code, it should not be a password. Okay.
Okay. Okay.
So maybe if you're not seeing your name, which I'm not, try to do QR code again, and then we'll wait for you. Okay.
Okay. Thank you.
Just let me know if you're having any trouble. Okay.
Okay.
I'm sorry, how
Uh,
do
Mavis, I believe. Yeah, Mavis. Do you have a question there? You have your hand raised. You have to unmute yourself if you do. Okay. All right. Anybody's having trouble? I know playing Kahoot the first time can be intimidating. Mavis, please unmute yourself and ask your question.
Dr. Lopez, where's the password? The PIN code.
The PIN code is 7917753.
Thank you.
Yes. Then you have to pick up a name. Okay, you can put your real name, you can put your fake name for the night, whatever you want to feel it. We have soon to be PMHNP. Whoop, whoop. Supernatural. Sono. What else? Deep. Florida. NPM. I don't know what that stands for. We have Alexa. So many folks of you guys. JB. A lot of people in today. So if you are in on our Google Meet, then use your phone. There is a QR code in the screen. And then you create your nickname. If asks for PIN code, is 7917753. Try to log in, guys, because it's fun. It's fun.
I don't.
Go ahead.
Where do you go? Where do you go to log in at?
Okay. Do you have a phone with you that you can join?
Oh, I'm on the phone. I need to be on the
Yeah.
computer and a phone.
Yes. Computer and the phone, because you are going to put in your answers on a phone.
Oh, okay. So I'm on the phone now, so I need to log on to the computer to see you guys, right?
Yeah. Right.
Okay. And then on the phone, where do I put this 7977953 code? Where do I click on
So
to put that in?
yeah, first join on Google Meet, and then you can free up your phone to use the QR code on the middle of the screen.
Okay.
If you do that.
I might have to hang up to do it. I'm thinking.
Say it
I don't
again.
know. I said I'm thinking I
Yeah.
may have to hang
So
up.
you may have to hang up, but you can join in anytime in the middle of the game, I believe, as well. Okay, so even if you join in late, it's fine. But at least you get the the hang of it for next time.
Okay, so the
You can
code again is
also
the code again is
7991
7991
7753.
53. Again, it's 799.
No, man.
sorry.
791
791
791 7753.
753. 791 7753.
Yes. Now
Okay.
you can also open your Google browser and go to www.kahoot.it, not .com, IT. You do that, and then it will ask you for a nickname and PIN number, and then you should be able to log in.
Okay. www.kahoot.it.
Correct. And then it should ask
Okay.
you for a PIN code, or should ask you to a nickname or something like that, and then it should okay, and then it should lead you to the right thing.
Okay, I'll do that now. Thank you.
Yeah, Tamara, if you sign in and you see your name, that means you are in. It takes a little bit of
Okay.
time. That means you are in. Okay, Helen, do you see yourself in?
Yes, and then so I tried to use Helen, but said it's taken. So I use my last name, Lin. I saw my name on a computer screen. I think I'm
Okay,
in.
all right, great.
Thank you.
All right, absolutely. Jacqueline, do you have a question there? Not sure if you have a question, Jacqueline. If you do, you have to unmute yourself.
I'm trying.
Please.
I'm trying to get in, but I haven't. I think I did. I just saw my name popped up. I'm good.
Okay, you're good. All right, guys. So we're trying to help everyone get in. I know it's a little bit. Yes, you're supposed to log in. So what do? Use your phone to here in the middle of the screen, there is a QR code. It may ask you for a PIN code, which is this right here. And then you have to create a nickname, whatever you want to be called for the night. You can also go to www.kahoot.it if you don't want to use the PIN code. Right? Okay. We'll give another 5 minutes just to be very respectful of everyone's time here. But please let me know if you're stuck. The game is about to begin. So, excuse me. So basically, Kahoot, you use your phone to select an answer. Now, be mindful that Kahoot only allows me few characters per answer, so I cannot give you a full answer. So patient might be abbreviated, maybe missing some conjunctions, something may be missing on that answer to make it a full correct answer. But we'll try our best to give you, to lead you to the right answer, right? Kahoot will also rank you, right? It might show the first 5 players, but you know your rank. Your goal is to always be in the first 10, right? That means that, hey, when compared to your peers, you are thriving, you are close by and doing well, okay? So at this time, use your phone when the answers pop up. Use your phone when the answers pop up, okay? You have to be fast. Some people said, my problem is I don't read fast. Well, this is why we're doing Kahoot, to help you read the answer, pick an answer within 1 minute every time. Every time you only have 1 minute. Okay, Christina, do you have a question there, my dear?
Hello,
No, okay, no question. Okay, no problem.
Dr. Lopez.
Hi.
Yeah, I'm trying to. How do you create the nickname?
Once you log in, did you use your QR code here on the screen?
Okay. Okay.
So use your QR
Click
code.
on it.
Yeah, you're gonna have to use your phone to do the QR code.
Oh, how?
Put in a camera, and then click on it, and it should take you to Kahoot as I'm doing here. So, and then you're gonna say nickname.
The camera is out, so it says name. What do I do there?
Okay, whatever you want to be called for the day, whatever your name is, or anyone's name that you want to be called, your choice.
Okay, so I should type. Okay, I got it.
And then let's say after that you should be in. Once you do that, it's gonna say, sorry, the name is already taken. I called myself John just to make sure. I don't know who picked John. So hey, I got John 2365. So that way you are in. Your nickname is on the screen. Great. And then you just stand fast. Once the game begins, you'll be able to pick a new answer. Divasla, I'm so sorry, I butchered your name. How can I help you there? You have your hand raised. You have to unmute yourself if you do have a question. Folks, so we have a lot of people, right? So, Astral, if you have a question, please unmute yourself.
Where do I go after? Where's this Kahoot thing now? I have so many windows open.
You should be only have your window for the meeting open, and with your phone, click on the QR code of the meeting here, where I'm having circling.
Well, it said verification was sent, verify email, and
No. Did you try to the QR code?
Well, the QR code is for the phone, but I'm on a computer.
So the computer should be only your Google Meet, right? You need a phone. I believe you need a phone to play your answers.
Oh, so I didn't need to create account?
No, none of that. All you gotta do is log in on the meeting like you are, close all your other windows, and use your phone to play the game.
I already did that.
Okay, so then do you see your nickname on the screen?
Yeah, I did. I was dealing with the computer part.
Then that's it. You don't need anything else. You are in. I'm about to start the game. Once I start the game, you are going to see a question, and then you're going to see 4 answers, and you use that by clicking on your phone the
Why
right
would I
answer.
ask the question on a meeting?
Yes,
Okay, got you. Thank you.
absolutely. Annette, do you have a question? Or
Yes.
Dorothy, do you have a question?
My question is, where will you answer, on your phone or the computer?
On your phone. That's why you need 2 devices. So on the meeting, we're meeting on a Google Meet. It's good because then I can talk and do things like that. But you're playing the game on your phone. Okay.
Dr. Lopez, what's the expected length of time of this game? 2
Less
hours,
than an hour. I would think an hour.
Okay, thank you.
Yeah, because usually what I do is after the question, we discuss a few things related to the subject. So it's 20 questions, and then I provide the rationale. Should not be taking more than an hour today. All right, guys. So we got 100 people. I believe we're ready to go. Hey, if you really score and that we have 100 people, I'm not sure how many are playing, but like out of 100, I'm pretty sure we don't have 100 people playing the game today. But like if you were scoring anywhere between the first 20, 30th, you are pretty strong. Okay. I mean, don't feel disappointed. And if you don't feel discouraged. It's just that they may have more time in a program than you. Or maybe they have seen things that you haven't. It doesn't mean that anyone is smarter than any other person. We're all the same, all of us. Maybe it's just a little bit more experience that we have in one area or done things differently. So your job is to find out how to do things differently if you want to improve it. I always say that the definition of craziness is doing the same thing every day and expecting different results. And this is not to insult anyone. What I'm saying is, if what you are doing is not working, try something new. Okay? All right, guys, the game is about to start. We have 64 people, so that's a good number. If you haven't been able to join in, you can always do it in the middle of the game. But for the sake of time and respect for the other folks that are in, we are about to begin. Good luck, everyone. And use your phone to press the answer. Okay, to select an answer. You have 4 boxes to choose from. Game starting, you have 1 minute. The answers will be short. Kahoot does not allow me to give a full answer. Good luck. Let's see who's gonna win the night. And by the way, let's see, after this question I'll talk. You have 1 minute. You have to be fast. You get points for being fast and points for being right. Please mute yourself. You have 30 seconds. Wow, you guys are fast. 20 seconds left. Ten seconds. Pick your answer. And the time is 5 seconds. Pick something. All right. So let's start by saying, what genetic assay of a client indicates generic variance? Never pick an answer because it sounds good if you don't know that. Ask yourself, have you ever seen anyone doing that? A generic assay for any condition? No, right? Sure, we can do something about medications to see, why the client is not responding, but it's not a true statement. It's a trap. Now, every time you see bipolar, somebody says, my mother has bipolar, and then you open your eyes really big and say, really, tell me more about it. Is it bipolar or borderline? Oh, it's bipolar. Ask your mother if she's on any medication and if it's really bipolar, because if it runs in a family, you should not give a antidepressant, or at least be super careful. For the board, don't do it. On your practice, maybe, if you're super careful with different other things going on. Okay, so paternal family history is unknown. Okay, if it's unknown, it doesn't necessarily mean it is a bad thing, right? It's in the middle. So multiple individuals with early age of death. I don't even know what that is. You know? So here we go. Alexa was the fastest and the most correct. Then you have Casey, Ginger, Liz, and Haisa, maybe? I don't know. All right, so here's the rationale. Take a minute to read, and we'll begin the next question. Next question. You have 1 minute. Seventeen seconds. All right, all right. So here's the thing, right? Remember what we teach you about the scales, right? Remember what we teach you about the scales. When to give medication, when not to give medication. So let's revise this for a second. Let's say you have your PHQ-9, and the PHQ-9 is 9. Let's call it 9, 8, 7. So your choice is only one here, therapy. You should not be starting medication on someone PHQ-9 of 7, 5. Guys, this is for the board, not real life here, okay? Now, when your PHQ-9, I'm just using PHQ-9 for example, is 10 to 14, or even 10 to, 18, something not super high. You know that 10 to 14 is your range of modern. Now you offer therapy, medication, or both. When your PHQ-9 becomes severe, 21, 22, only one choice: assess for suicidality. And that is applicable to the HAM-D. That is applicable even to GAD-7 or the GAD or the HAM-A, right? So if the score is too high, your job is to assess for suicidality, okay? So hopefully that's understood. So let's see what's next here. And remember, yesterday we discussed this in the sense of not changing your medication within the first 6 weeks, right? Unless, if you prescribe medication, the patient come back, you shouldn't change unless if there is any indication that the medication is causing more suicidal thoughts. So the HAM-D, and I believe the score was 28, right? Very severe depression. So at that point, your job is not to start medication, but assess for suicidality. Please read the rationale. All right, next question. In between those questions, if you do have a question, please unmute yourself and ask. Rather that we iron out those questions now than having you going home with questions on your mind. All right, next question. Good luck. All right, you have 4 seconds. Pick an answer, quick and chew and go. All right, so most of you guys got this one right? So I always say before you report anything to CPS, assess the situation. Here, you have assessed the situation, but the mother is insisting on a anxiolytic medication, right? Someone with a BMI of 14, 15, and even 16, they are at risk for electrolyte imbalance. They are at risk of many complications, even high risk of death, right? It can be severe. So in that case, you're trying to initiate treatment. The mother say, no, I don't want a treatment. Then reporting to CPS is the right thing to do. Do not be calling the police. This is not a police case. If the answer says call the police, that would be incorrect. This is a CPS case, right? You're looking out for the welfare of your client here. Okay, Waddler, please ask your question.
Yes, Dr. Lopez. I'm a little confused right there because you said anything BMI less than 50, less than 15.
Okay, so I think the question said 14.
Oh.
Right? I believe the question said 14, but it really is BMI anything less than 16 is critical.
Okay, thank you.
So hopefully the board will not be like, is it 16? Or, it'll give you like something like 14. 14 is pretty critical. Okay.
What's
Thank
wrong
you.
with the patient?
Say it again.
What is wrong with the patient?
So anorexia patient with a low
Does it say
BMI.
that?
Well, it doesn't, but it gives you all the indication. Okay. I can't go back to the question, but I believe it told you the physical symptoms like BMI is 14, bradycardia, hyperthermia, orthostatic hypertension. So it's telling you the BMI is 14, so it's telling you the patient is anorexia. So the question may not say the patient is for you to figure out what the BMI of 14 means, right? So it's indication of severe psychological compromise, like related to eating disorder, right? Anorexia. So the BMI. So what we know, one with anorexia will have low BMI. One with bulimia will likely have a normal BMI. Okay. So what was the answer? Report to CPS. Okay. Mother says, hey, I would like this patient to go home. We'll start a anxiolytic. Everything's going to be fine. No, this patient's at danger. Cardiac bradycardia was at 45. Okay. I knew that one. Okay, great. So next question. All right, 2 seconds and go. All right, so this one is a pretty simple, right? Frontal lobe injuries, right? They'll have personality issues. Now, some people pick having difficulty with comprehension. What lobe would that be?
Temporal.
Temporal, right? So if it's difficult, I can see slurred experience with slurred speech. Someone can say frontal lobe, broken area. Yes, sure, I got it. And I can even buy that. But is that a stronger answer than difficulties with problem solving? That is the highest thing of a frontal lobe, right? Sure, personality too. Anytime you hear frontal lobe, think of personality, please. Okay. In the course, we talked about someone that got injured, and after that, frontal lobe was destroyed, and he became pretty much a different person. So, executive function, planning, organization, decision making, problem solving, impulse control. Oh, yeah. Remember yesterday we said, what are the 3 places that we have ADHD patients that will have problems with? Right? We said frontal lobe, basal ganglion.
Yeah.
Yeah. And
Reticular or something.
yeah, reticular activating system, right? So we are putting what we learned in practice. So remember that. That's going to come in play on your test, possibly, right? But as you can see, impulse control is part of the frontal lobe. Now you can connect with the ADHD diagnosis that we covered yesterday. All right. All right. Good job, everyone. Next question. It's a hard question, right? It's gonna. All right. "15 seconds. Pick your best answer. 10 seconds left. All right, enmeshment, right? So let's break this down a little bit. It said dependency as the first stage of over identification, encounter transfer issues between the patient and the therapist. Okay, fluff, right? Can lead to subtle pathological. So we now know this is not good. Bonding. So what does it mean? Enmeshment, right? So no one knows where the lines is. So the therapist might misinterpret the patient's reaction as enmeshment. Okay. Very hard question because it's so all over the place, right? But it is for a reason. But please take a look on the rationale. Blurring of the boundaries as a sign of a deep connection or progress, when in reality it is an unhealthy enmeshment. This interpretation aligns perfectly with the description of subtle pathological bounding. I think that was what first thing came to mind, right? So it's something bad.
So the answer should be A, not whatever, because that's what it says right here.
What do you mean right here?
When in reality, wait a minute, it says patient intense reliance or basically what it says that what it's not, so the therapist misinterpret, so the therapist misinterpret the progress as enmeshment. So the answer is the progress, not enmeshment.
No. So, because the pathological bonding, right? So basically here saying, hey, something is, is not occurring as way we intend. So it is the therapist may interpret this as is enmeshment.
No, the
Right.
therapist misinterpret it as progress, while it's actually in reality enmeshment. So the
Right.
therapist thinks it's progress.
Oh, I see
So
what you're
the
saying.
question was asking what therapist thought it was. So the therapist thought it was enmeshed, so that's why I pick A.
Mm-hmm.
That's
So, and then it says that the therapist sees the patient complete reliance as a good client engagement rather than
right.
the lack of a differentiation.
Yeah, so basically the problem, not enmeshment. What is enmeshment?
What you think enmeshment is to us? Then let's
It's kind of like shake up, I don't know, get too close.
well, enmeshment is when
Stepping on somebody's toes.
perfect. Enmeshment is when the lines are blurred, right? So let's put this way. Well, I wouldn't say that, but yeah, I'm not gonna give this example. But like when we don't know, sometimes we may say something because we think that the person is okay to receive that, but they are not because they have different boundaries. But the boundaries were not clear, and this may be the reason why someone said something, right? All right, we'll keep on going, and we can always revise this question at a later time. Next question. You can use your phone by logging in at www.kahoot.it, not .com. I'll write it down for you. Once you log in, you gotta create a nickname, and the password or the PIN code is 7917753. All right, you have 13 seconds. All right, so PTSD, right? So this is what we were talking about yesterday, right? So if you have a patient that has had PTSD in the past and got in a car accident now, and now can't leave the house, this is a re-trigger of his PTSD. You would not diagnose this patient with acute stress disorder. Again, this is for the board, right? Now, if it's a completely, totally, I would say in real life, we can do a little bit subtle difference, but here it's more recuing you that the patient had PTSD, now had another traumatic event. So now you re-diagnose the patient or keep the same diagnosis, PTSD. The pitfall is 2 weeks, 3 weeks, 4 weeks, because they know you are looking for a number, okay? And you are looking for the 4 weeks or less to be acute stress disorder. But the underlying answer is if one had PTSD and the new traumatic event happened, then is a reactivation of the PTSD. Okay. Next question. 20 seconds left. All right, I'm very proud of you guys. Super cool. 59 folks got it right. And now let's do a little bit backtracking. How do I know right from the beginning of the question? It says, I don't know if it was a 30 years old Hispanic. It went out of the way to tell about his background. So now automatically you should be thinking this is a cultural question, right? And the cultural question does not want a scientific answer. It wants something like, please help me understand your culture. What does it mean in your culture? Could you educate me? Because I'm not aware what it means in your culture, right? So we want to validate them rather than saying, you'll be fine, or I don't think you're feeling this way, you are over exaggerating. Things like that would not fall within the alliance of therapeutic alliance. So if you hear, someone from Africa, if you see someone from Africa, someone from Mexico, someone from Brazil, a Hispanic, or whatever, that's kind of odd, be thinking, those are cultural questions. Someone's passed the test today and said there was a lot of cultural questions. So you should be looking for a cultural answer. And usually is help me understand what you are going through. Okay? Things along the lines, because you may not know what is a Hispanic person specific, about their culture. Okay, should not let me collect labs and so forth. Things like that should be incorrect. All right, next question. Oh, everybody's fast, huh? So you get points for being fast, okay? So all right. So when you have something that's related to CBIRT, right? It stands for screening, brief intervention, referral, and treatment. It really is a comprehensive public health approach used to identify adults, well, not even adults, I'll take that back, identify and address SUDC, substance use disorder, right? And related risk behaviors, okay? So I have seen other folks using this for traumatic or assaults as well, but usually most of the time, I would say 90% of the time, I've seen this type of intervention towards SUDC or substance use disorder. Okay, so it's an evidence-based, or it's a public health approach here to identify, reduce, and prevent problematic substance use, including alcohol and illicit drugs. Remember, when we do this, what kind of scales do we use? Outed, right? Outed is more comprehensive than CAGE. And remember, you have to know what CAGE stands for in details. Because if you kind of know, the test might give you, ask what CAGE stands for, and may trick you, right? Because you kind of know. So please know the definition of cage by the letters as well. Next question. All right, so it's factitious disorder. I can never forget this example with one of our students. Well, she wasn't our student, but then she came and said she failed the test. And she said, I got confused between factitious disorder and malingering, and I totally knew what it was, right? So now let's take a look on this. If you have factitious disorder, meaning someone is doing something to get attention or some kind of emotional support in the incorrect way, right? Now, if you have a mother hurting the child, the father hurting the child by making them sick, feeding them things that are not appropriate or whatever, that is factitious disorder on another. That is a CPS reporting. Malingering, you want something. You want money. The patient wants money, time off. They are doing that to gain something in exchange. Factitious, they're doing that for emotional support, right? And then what else we covered yesterday? What was the other condition that we covered yesterday, just to make a final thought on this? We also cover conversion disorder, right? Conversion disorder, that was an assault. What I mean is a traumatic event. Let's say my mother died. Now the patient would feel they cannot see, they cannot walk, they would have a neurological problem. And how you know if this is a adjustment versus adjustment disorder versus a conversion disorder, look at the question. Oftentimes we'll say clear by neurology. And look at the symptoms. Are the symptoms depression or anxiety? Or the symptoms neurological? Blindness, paralysis. So no somatic disorder, conversion disorder, adjustment disorder in multiple subsettings of adjustment disorder, no major depressive disorder, pseudo dementia, factitious disorder, and malingering, because those terms can get a little bit confusing and you need to know them in detail. Okay. Next question. Now you do not need a Kahoot account to log in. If someone if they have a joint account, they are solving the problems together, whether it's marital problems, whatever problems might be, you should only see them together. All right, because that could be, that could leave room for impartiality, that could leave room for even a HIPAA violation, right? Just because they've been together doesn't mean that that specific encounter, the patient authorized you to discuss something about them, right? But know that if the appointment were made for them to attend together, one does not show up, cancel the appointment and reschedule. Okay. You shouldn't see only the wife or only the husband. You should see them both together at the same time. Next question. All right, guys, super fast. We got about 35 seconds left. All right, so we know lamotrigine. We covered this yesterday. We said lamotrigine is the least weight-gaining mood stabilizer. Also, we said Geodon, Latura, Abilify. Those are the skinny meds for your psychiatric, not psychiatric, antipsychotic medications that we covered yesterday, right? So if someone is already obese and you want to necessitate a mood stabilizer that is somewhat weight gaining, or at least the least problematic.
No problem with the answer. No.
It said the answer was wrong.
The answer was keyed in incorrectly.
Oh, okay. Do apologize about that. It should be lamotrigine. Okay, lamotrigine. So I probably keyed in incorrectly. So the answer is lamotrigine. Thank you for that. Appreciate it.
Yes, 60 of us got it wrong.
Yeah, sometimes it, throughout the days can all blur together, and my team may miss one. So lamotrigine. So now let's talk about lamotrigine. You gotta go low and slow. What I mean by that? Real life here. Okay, it can show up on your board. Let's say you have someone with bipolar and you want them to start on lamotrigine because that's very good for bipolar depression. How do you do it? Low and slow. What I mean by that, start at 20. This is how I do it. Start at 25 milligrams. Wait 2 weeks, then double the dose. Then you do 50 milligrams. Wait 2 weeks, double the dose. Now you are at 100 milligrams. Wait 2 weeks, double the dose. Now you are 200 milligrams. If you need to double the dose, it doesn't mean you should be at 200, but if you need to, then wait 2 weeks. Why? Because of the risk of Stevens-Johnson syndrome. Okay, so be careful. It's a great medication. Second point, if the patient develops a rash while taking lamotrigine and the rash goes away, I got a rash under my armpit or my whatever, my legs, right? And then resolves on its own, do not stop the medication. It is not Stevens-Johnson syndrome. Okay, be careful because it's very serious, and we see rashes. I'm like, oh my God, it's a rash. No, Steven Johnson syndrome is serious. And if you don't know what Steven Johnson syndrome, please Google it because the image is going to shock you. Okay, next question. Remember what we said in our course to answer this question. All right. During a grief process, families that are close together, families that are healthy, boundaries that are, I wouldn't say intact family because I don't even think there is such a thing as a completely intact family, but families that support each other, they are there for each other, they are able to recover from a bad outcome, right? Of a grieving process faster than those families that are unhealthy boundaries, right? So when you have a question that maybe the mother lost her unborn baby, or the baby was premature, or a disaster of some sort, like that involves a traumatic event, do not tell the mother, the father, or anybody in the family how to grieve. Do not rush them to clean the room because the room needs to be cleaned. Okay, you're looking for a empathetic answer. If someone, do not tell them they should work harder, that working is helpful to forget about XYZ. Do not tell them that they should get another dog and replace that dog or get another baby. Okay, they grieve however they feel like the grieving should be done. Okay, so what you do is you provide support and perhaps resources. Okay, but don't tell them what they should do, please. All right. So remember that the student that I said she confused malingering and factitious disorder. She also said I confuse cows with SIWA, right? So it's a good way to say that hey, she went to test and she kind of rushed through the process and didn't really learn. She kind of knew about it, but didn't really know well for testing. And if you don't know well for testing, it is likely that will be a very difficult testing. When do you use SIWA? For alcohol detoxification, right? It's not maintenance. They're going through a detox. They have excessive drinking. They stopped drinking for whatever reason, and now they are going through uh, uh, possibly withdrawals, right? And that's when we use SIWA. Now, can anyone tell me when we start SIWA? What number?
8.
8, 7, great. That's it. Just because it said 7, it doesn't mean it is. Some book says 8 or 7, so great. What happened when you get to the next score? What's the next score in which you give a PRN plus schedule? 15. So you start at 7. Hey, Mr. John, would you like your Ativan or lorazepam? And said, no, I'm good. And then maybe a score of the next time is 9, right? You offer it again. He said, okay, I'll take it. Thank you. Now, next time you go and the score is 15, at that time, you need to schedule the patient on a short acting, right? What is Librium, Ativan, lorazepam, right? It would depend. Schedule every 4 hours, every 6 hours, however the practitioner wants to, and then plus PRN. Let's say it's every 8 hours. Then you offer PRN every 4 hours. So it needs to have both. Now, when do you do lorazepam versus other medication? If you have a liver injury, if the question goes on to say has cirrhosis or elevated liver enzymes, then it's telling you you have a liver injury. Then you offer lorazepam because it's in and out and less lingering, less harmful to the liver. Okay, someone had the question, what the question would be? If you want to mute yourself, if not, we'll keep on going.
I have a question.
Please.
So if they do have a liver injury and say, for instance, you have to give them their scores of 15. And
Yes.
now they need a scheduled and a PRN.
Correct.
And we know, okay, Ativan, we give, at that point, would that now become scheduled? What will be the PRN dose then?
Same thing.
So you give
Same.
Ativan and Ativan?
Sure. Yeah.
Oh,
Out of
okay.
it. Now, if yeah, absolutely. Now, if someone is liver compromised, then you try to give the least amount of medication to achieve the job, obviously, right? So, but for the test, think of it. If it hits 15, now is schedule plus PRN. Okay. So if it's less than 15. Hey, would you like some now? No? Okay, I'll check back in the next 6 hours when I do again my CWIS score. All right, great question though. All right, next question. All right, so you want to evaluate the patient's cognitive function using his screen instrument. So good job, everyone. Ooh. So, okay, we're actually gonna skip this one. I think my answers are not correct there. What do you do during reflective practice? It's a hard question, okay? This is a hard question. Very hard. Okay. And the reason it's very hard is because the green there, right? It's very misleading and it sounds so good. But if you think of reflective practice, right? It's what A is saying is sort of debriefing or write or tell a stories on their own personal experience. How did you go through that? And it's very close to the green answer. Training group members in critical debriefing strategy after each event, right? So if a student had a bad outcome or after, debriefing, it is reflective practice is debriefing, but how do you do it? You don't train them on critical debriefing strategy. You you ask them how did they go through with this event from their own perspective experience. So very close answer. I get it. Very misleading too. Okay, very difficult answer, right? Reflective practice. Okay, so if you chose the green, don't feel disappointed. There was the key word was there for debriefing to trick you. Okay, but remember, debriefing is telling a reflective practice of what happened from their own account. Okay, Jacqueline, can you unmute yourself there? Okay, all right, moving on. If you can unmute yourself, Jacqueline, advise. Okay, moving on, next question. Don't feel disappointed. This one's extremely hard. Okay. This one is hard too. Very hard too, as well. All right. So, yeah, when one cannot fully construct a narrative, right? You want to give them a little bit of choices, right? Hey, do you feel sad? When you feel sad, how do you feel about it? And give them some. Do you stay at home? Do you eat less? A little bit, rather than do you feel sad? Yes or no? Hey, uh, what do you do when you feel sad? Can't be done with a yes or no, right? Given a little bit. Of course, we don't want it to be a complex um, answer either, but a little bit of in between close answer, but allowing them a little bit of room to still provide some feedback. Okay, so that's why I said it's a difficult answer between close answer and partially open answer. Okay, we're almost there for the day. All right, very good. So recovery, right, especially with substance abuse, is not just if you do this, you get this. It is a learning process. There will be ups and downs as long as when the person falls a little bit short, they can pick up themselves, learn about it, and try to do better, right? Um, in some places, we say, hey, if you have 3 labs that came back positive, we're going to kick you out of the program, right? In some places are less restrict, where we say, okay, let's talk about what led you to doing this again. How did you feel about it? What did you learn from that? And recovery, it's all about that. As you working with the patient to help them achieve the next level. And that's what they need, right? Being very strict is not helpful. So know that the recovery model for the test is full of ups and downs, and they learn from their own experience. That is the point that I was trying to drive. Okay, next question. All right, so everyone pretty much got this in the right amount. Please never pick something that sounds good and you're not sure what that means. Like idiosyncritic increase in sensitivity to neuroleptic medications. Yeah, it sounds like complicated, right? But that is always almost a trap on your answers for the board, right? Because people, we know like, oh, let's put something fancy here as the one of the answer choice to trick those that are maybe unsure about the answer. Yeah, when you have a CPK that's elevated due to NMS, right, is because of the muscles breakdown. Now here, how there was 2 answers when muscles breakdown, right? One was due to the injection. Was it what caused NMS? No, it wasn't, right? So the hallmark features of a NMS, neuroleptic malignant syndrome, is severe muscle rigidity, right? Often called lead pipe rigidity. When you have this rigidity, your muscle starts to break down and your CPK will be elevated, right? And how do you do it? How do you clear that? By giving a lot of fluids, right? I'm sure that you worked in a med surg floor. You probably seen a guy that went to the gym, was working out very hard, and now they came back and be like, oh, my pee looks like Coca-Cola color, right? So
Rhabdo.
rhabdomyolysis, yes, and there's close related to that, right? So that's one thing that you need to watch out for, is rhabdomyolysis for NMS. All right. So if one of the answers was Rett syndrome, how would you differentiate? This question said the child's gross and fine motor skill remains intact, right? So that should give you a cue that it is not Rett syndrome, even though this is pretty clear, is autism spectrum disorder. Remember what we said yesterday. You know, they have difficulties in responding, maintaining eye contact, being called by their names, and they're not looking or responding. Remember about the broken neuron, what we discussed yesterday, right? And what it means, okay? Restricted repetitive patterns of behaviors, interests, and or activities, right? Lining up toys. And remember what we said, we need to know your chat, you need to know your cars, and if you don't know what I'm talking about, it's the scales to help you make the assessment and continue to reassess those patients as you see them for progress of your intervention. All right, last question here, guys. It's a hard question too, right? Okay, so most of you guys got it, right? So if someone just have gone through a critical a specific trauma, right? You want to know where and with whom are you living right now. This has helped them to go back to a safe place. It's more important than what are you feeling about your spouse, what are you feeling about your spouse's death, what other significant losses have you experienced in your life, or do you have any pre-existing mental health condition. In addition to that, when you have questions related to crisis, you do not want to initiate new coping skills. You want to know what coping skills they have currently and they used in the past to overcome difficulties. That is very important. During crisis, do not start a new coping skill. Look what they have done in the past and see if you can reutilize those skills rather than initiating a new coping skills. All right. So let's see who really score high this evening here. All right, Ginger, good job, third place. RK, all right, and now who was the winner? KC, well done, guys. And fourth place, we have a Supernatural maybe, and Pass something. But everyone is really good, and thank you for showing up today. Hopefully we learned something together. If you have issues, concerns, or you want to stick around and learn few things about the course, this is what we're going to talk about. If you've been in a course for a while and you know where things are located, please have a good evening and enjoy your time off. Now, also, it's a great time to talk about anything that's in your mind, right? What are your concerns, issues? I know, so I received tons of email about the diagnosis test 3. I promise you, as immediately after today, I'm going to reply to all of them. I have not had the chance to look at my email today, but you will be receiving that. If you are not testing within 7 days, please wait. I am redefining some of the answers or questions to better serve you. Okay, but if you are testing in the 7 days and you're really dying to get it, I will release for you now. But I prefer not to, just because I like to make sure that the answers are right. This is a complex process. Got to make sure the question is very good for you, that is clear and does not cause you distress, right? So what I would do is we'll take a 10 minutes break. All right, we'll be back at 6:32, and at that time what I'll do is go over the course, show you where the PDFs are located, show you where you can use the fancy tools within the course to help you better prepare for the board. So